The Public Health Emergency Volunteer Reserve, or PHEVR as it's known, is the North Dakota unit of a national program called the Medical Reserve Corps. The Medical Reserve Corps, or MRC, was started in 2002, in part to fill a need noted after the terrorist attacks on 9/11. The vision of the MRC was to create a nationwide network of organized medical and non-medical volunteers to strengthen the health and safety of their communities. Today, there are over 200,000 Medical Reserve Corps volunteers in over 750 units across the United States. The ongoing mission of the Medical Reserve Corps is to improve the health and safety of communities across the country by organizing and using public health, medical, and non-medical volunteers in disasters and in support of community health projects. In North Dakota, the primary mission of our Medical Reserve Corps unit, PHEVR, is to respond to public health emergencies. Registration of PHEVR volunteers is entirely online and is available 24 hours a day at the North Dakota Department of Health website. All volunteers register online, whether they are medical or non-medical volunteers. During the registration process, an applicant will be asked questions regarding their skills and training. For medical volunteers, credentials and employment will be verified with the appropriate licensing agency and employer. All volunteers will be asked about any prior convictions in civil or criminal court. This will also be verified by the volunteer coordinator through an online background check. Once all the verifications are complete, that volunteer will be notified by email that the application for PHEVR-MRC has been accepted, and they are then considered an active volunteer and eligible for deployment to an emergency or disaster. As a part of the Incident Command System, PHEVR-MRC volunteers operate under the command and control of the North Dakota Department of Health Emergency Operations Center, or DOC, while deployed. When a local or regional facility needs volunteers, a representative from that facility first contacts the DOC. They identify the type and number of volunteers needed, medical or non-medical, and if medical, what occupations, specialties, or skill levels, what tasks the volunteers will be asked to perform, and where they will be deployed. A local contact person would also need to be identified. The volunteer coordinator will send out a message through the Health Alert Network to all active volunteers with the requested credentials. The volunteers who are contacted are then asked to log into the online account that they created when they registered as a volunteer and to answer a question regarding their availability for possible deployment. The qualifications of volunteers who indicate they are available will be reviewed by the incident commander, and those who are best suited for the deployment will be contacted with more specific details regarding that deployment. Those volunteers who indicate they want to be deployed may be offered a contract with the North Dakota Department of Health, depending on the situation. This document would detail the roles and responsibilities of the volunteer, as well as any compensation for expenses. Contracts are not used for every deployment, and compensation for expenses will be dependent on the situation. Once the volunteer has signed and returned the contract, if applicable, that volunteer is then considered deployed. If a contract is not being used, volunteers who receive the second notification will be asked to respond by email to the volunteer coordinator to accept the deployment mission. Once a volunteer responds and accepts, he or she is considered deployed. Once deployed, volunteers will check in at the staging area of the incident as established by the requesting entity. There they will receive their badge, an orientation briefing, and their specific assignment. Ongoing supervision is the responsibility of the local agency requesting the volunteers. It is the responsibility of the volunteers to make all necessary arrangement with their employers to be granted time off to volunteer. All deployments are always completely voluntary, and an inability to be deployed for one event will not negatively impact a volunteer's chances of being contacted for any other volunteer opportunities. When PHEVR-MRC volunteers are deployed or are participating in an approved exercise, they are covered under North Dakota Workforce Safety Insurance, also known as Workers' Comp. PHEVR-MRC volunteers also have tort protection under North Dakota state law, as long as they are deployed through this system and are acting in their official capacity of PHEVR-MRC volunteer within the scope of their assignment. If volunteers are deployed outside of North Dakota, their liability protection is provided by the requesting state. In that case, their North Dakota professional license will be recognized by the state requesting their assistance. The final step in the deployment process occurs when the volunteers have completed their assigned mission and can be demobilized. This generally occurs at the staging area, where volunteers will return their badges as well as any equipment which has been issued to them and be officially released from their volunteer responsibilities. In summary, Public Health Emergency Volunteer Reserve, Medical Reserve Corps volunteers are an asset to their community and the emergency management system because they are pre-registered and their credentials have been verified before a disaster. When volunteers are deployed, they will get 2 contacts, either by phone or email. The first contact will let them know that there is a need for someone with their skills and that they should log into their account to answer the question regarding their availability. The second contact, for those who indicated they were available, will inform them that their offer to assist has been accepted. To request volunteers, contact the Department Operations Center, or DOC, or the Volunteer Coordinator and indicate how many volunteers are requested, what skills or licenses are needed, where the volunteers will be working, the location of the staging area, and the name and contact information for the local contact. Remember, the requesting entity has the responsibility for volunteer supervision on scene, as well as volunteer check-in at the local staging area. PHEVR-MRC volunteers have proven to be an extremely important piece of the overall public health response in emergencies. The North Dakota Department of Health truly appreciates the dedicated men and women who volunteer their time and talents to assist the people of this state and others in times of crisis.